Last Thursday afternoon, Margaret walked into my office, 72 years old, sharp as a tack, but gripping her daughter's arm like she'd never done before. "Doctor," she said, "I can't get out of my bathtub anymore." Now, Margaret isn't frail. She's the woman who tends her garden every morning, who walks to church 3 times a week. But over the past 8 months, something changed. Her legs felt weak. Climbing stairs became a negotiation. Getting up from a low chair required planning. Her daughter thought it was just aging. Margaret worried it was something worse. But when I looked at her medication list, one pill caught my eye immediately. The same pill that 30 million Americans over 60 take every single day. A medication her cardiologist prescribed 5 years ago and nobody questioned since. Her statin. Here is what makes me lose sleep. I see this pattern almost every week now. Patients losing strength, losing independence, and nobody, not their specialists, not their pharmacists, not even their own bodies at first, connects it to the little pill they swallow every night for their cholesterol. Today, we need to have a conversation that most doctors won't give you time for in a 7-minute appointment, because what I'm about to show you isn't about stopping your medications. It's about understanding a trade-off nobody explained to you. When your doctor handed you that statin prescription, Lipitor, Crestor, Zocor, any of them, what did they tell you? Probably something like, "This will lower your cholesterol and protect your heart." What they probably didn't tell you: statins don't just lower cholesterol. They interfere with a compound your muscles desperately need to create energy. It's called coenzyme Q10, or CoQ10. Think of CoQ10 as the spark plug in every cell of your body. Without it, your cellular engines sputter. Your muscles can't generate the power they used to. And where do you feel this first? Your largest muscle groups, your thighs, your hips, your legs. This isn't a side effect that happens to other people. A 2024 study published in the Journal of Clinical Lipidology found that up to 29% of patients on statins experience muscle-related symptoms. That's nearly 1 in 3. But here's the cruel part. The weakness comes on slowly, so slowly that you blame age. You blame inactivity. You stop doing the things that keep you strong because you think you can't anymore. Meanwhile, the real thief is sitting in your medicine cabinet. Now, I know what you're thinking. "Doctor, my cardiologist prescribed this. Are you telling me to stop taking it?" Absolutely not. What I'm telling you is this: you deserve to know the full story. You deserve to understand that protecting your heart might be costing you something else: your muscle strength, your mobility, your independence. And more importantly, you deserve to know there are ways to protect both. Stay with me, because what happens at the cellular level will change how you think about this medication. Let me show you exactly what's happening inside your body right now. Statins work by blocking an enzyme in your liver called HMG-CoA reductase. This enzyme makes cholesterol, but it also makes CoQ10. When you block one, you block both. Your heart uses more CoQ10 than almost any other organ. It beats 100,000 times a day. Every single beat requires energy, and CoQ10 is essential to producing that energy. But your leg muscles? They need it too. When you stand up from a chair, when you climb stairs, when you walk across a parking lot, your muscles are burning energy. Without adequate CoQ10, they can't keep up. The result? What doctors call statin-associated muscle symptoms. What you call weakness, heaviness, cramping, or that feeling that your legs just don't work like they used to. A landmark study from the Cleveland Clinic in 2023 found that older adults on high-intensity statins showed measurable declines in grip strength and walking speed over just 18 months. Let me be clear, these aren't just numbers on a page. Weak legs mean falls. Falls mean fractures. Fractures at our age mean a cascade of complications that steal years from our lives. Here's what I need to know. Have you noticed your legs feeling weaker since starting a statin? Maybe trouble with stairs? Difficulty standing from a low seat? Type yes in the comments below. I read every single one, and your answers help me understand what to cover next. Margaret didn't connect her symptoms to her statin because nobody told her what to look for, so let me tell you now. These are the warning signs that your statin might be stealing your strength. 1. Leg heaviness, especially after walking or climbing stairs. It feels like you're carrying extra weight. 2. Difficulty rising from a chair without using your arms. You find yourself needing to push off or grab onto something. 3. Muscle cramps, particularly at night. These aren't the quick Charlie horses, they're deep, persistent aches. 4. General fatigue that isn't explained by poor sleep or other conditions. You feel drained by activities that used to be routine. 5. A noticeable decline in how far you can walk. Your radius is shrinking. Now, look at your own hands for this sign. Try standing up from your chair right now without using your arms, just your legs. Can you do it smoothly, or do you need momentum, a push, a grab? This simple test tells you more about your functional muscle strength than any blood test. I want to pause here because I can feel some of you getting worried. Maybe you're on a statin. Maybe you're noticing these exact symptoms. Here's the truth. This isn't about fear. It's about information. The overwhelming majority of people on statins need them. Heart disease is still the leading cause of death in our age group. Statins save lives. There's no debate about that. But what I'm fighting for is your right to a complete conversation, a conversation about balance, about protecting your heart while also protecting your mobility and your independence. And that conversation starts with understanding your options. When I sat down with Margaret, here's what we discussed, and these are the same options I want you to bring to your doctor. Option 1, CoQ10 supplementation. Multiple studies, including a comprehensive review in Mayo Clinic proceedings, show that taking CoQ10 supplements can reduce or even eliminate statin-related muscle symptoms. The dose matters. Most studies use between 100 and 200 milligrams daily. The ubiquinol form absorbs better, especially for those of us over 60. This isn't a fringe idea. This is mainstream science that your doctor may not have time to discuss. Option 2, adjusting your statin dose or type. Not all statins affect muscles equally. Some are more lipophilic, meaning they penetrate muscle tissue more deeply. Switching from one statin to another or lowering the dose can sometimes protect your heart while reducing muscle symptoms. This requires a conversation with your cardiologist, but it's a conversation worth having. Option 3, intermittent dosing. Some research suggests that taking statins every other day, or even just a few times per week, can maintain cholesterol benefits while reducing side effects. This isn't right for everyone, but for some patients, it's a game changer. Option 4, comprehensive risk assessment. Here's a question most doctors never ask. Do you actually need the high-intensity statin you're on? Many seniors were started on statins years ago based on older guidelines. But your risk profile changes. Your cholesterol goals might be different now. A thorough reassessment, looking at your current heart health, your calcium score, your overall risk, might reveal that a lower dose or even a different approach entirely is appropriate. We didn't stop Margaret's statin, but we made changes. First, we added 200 milligrams of ubiquinol CoQ10 daily. Second, we coordinated with her cardiologist to switch her from atorvastatin 80 milligrams to rosuvastatin 10 milligrams, a lower intensity statin with a different muscle profile. Third, we started her on a simple resistance exercise program, just chair squats and sit to stands, 3 times a week. Within 6 weeks, Margaret called me. "Doctor, I got out of the bathtub by myself yesterday. I actually cried." Her strength wasn't completely restored overnight, but the trajectory changed. She went from declining to rebuilding. And her cholesterol? Still well controlled. This is what balance looks like. I want to hear from you right now. What statin are you on? What dose? And have you experienced any muscle weakness or fatigue? Drop your medication name in the comments. Lipitor, Crestor, Zocor, simvastatin, whatever it is. I'm planning a follow-up Q&A video where I'll address specific medications and your questions directly. Your input shapes what I cover next. This channel exists because of you. Here's what this conversation is really about. It's not just statins. It's not just muscle strength. It's about the reality that modern medicine often treats numbers, cholesterol levels, blood pressure readings, without fully considering how those treatments affect your daily life. You can have perfect labs and still lose your independence. You can have a healthy cholesterol panel and still be unable to walk to your mailbox. And nobody wins when that happens. What I want for you is both. I want your heart protected and your legs strong. I want your arteries clear and your body capable. That requires partnership between you and your doctors, between your medications and your lifestyle, between managing disease and preserving quality of life. The truth is this: getting older doesn't mean getting weaker. Yes, we lose muscle as we age. Yes, our bodies change, but the speed and severity of that decline is not set in stone. When medications contribute to muscle loss, we can address it. When strength fades, we can rebuild it. When you feel yourself shrinking into a smaller life, fewer activities, less independence, more fear, we can reverse that trajectory. But it starts with asking the right questions. It starts with a doctor who sees you as a whole person, not just a cholesterol number. And it starts with you refusing to accept that's just aging as an answer when something deeper might be going on. If you're on a statin, I want you to do one thing today: not stop your medication, not panic. Just one simple action: schedule a conversation with your doctor. Bring this video. Ask about CoQ10. Ask if your current dose and type of statin is still the best choice for you. Ask about muscle symptoms, even if you think they're mild. Advocacy starts with conversation. And then come back here and tell me, what one change are you going to make today to protect both your heart and your strength? Write it in the comments. Make it real by putting it into words. If this video helped you see your medication in a new light, share it with one friend who needs to hear this. Someone else in your life is probably struggling with the same trade-off and doesn't know it yet. My job isn't to scare you. It's to tell you the truth that a 7-minute appointment doesn't have time for. Your heart matters, and so do your legs.